Hello, I'm Dr. Kushal Hippalgaonkar, Orthopaedic surgeon at Sunshine Hospitals. Today I'll be talking about ACL injuries and how to treat them. So what is ACL? ACL stands for anterior cruciate ligament. That means if this is your knee joint, I've just moved the kneecap away, the thigh bone, that is the femur, and the leg bone, that is the tibia, make up this knee joint. And the anterior cruciate ligament is this brown structure, that is the band of tissue that connects the femur to the tibia. Now, the function of this ACL is to prevent instability, that means anterior posterior, which means forward backward movement of this leg bone on the thigh bone. So, in short, the presence of ACL prevents your knee from becoming unstable. Coming to the injuries of the ACL typically gets injured when there's a severe twisting motion or a twisting strain on the knee joint. This happens typically during road traffic accidents and is very common in athletes during their sporting injuries. Now, depending on the severity of this twisting injury, the ACL might either be torn completely or partially. So, coming to the symptoms of ACL injury, at the time of injury, there may be a pain and swelling in the knee joint that is affected, and then it becomes difficult for the patient to bear weight on that limb while climbing downstairs or trying to run or jog, or even while walking on uneven surfaces. So, these are some of the symptoms, and the most significant of this symptom is definitely instability. Diagnosis of ACL injury is fairly simple. When the patient gives a history of injury coupled with the pain, swelling and symptoms of instability, we at the clinic do an X-ray and an MRI to see the extent of this injury, and after having done this, it is fairly simple to diagnose and establish that the ACL is injured. Now, the treatment of ACL injuries may be non-operatively or operatively. That means, in the acute stage, we give rest, medicines and ice and protection to the lower limb, to that knee joint, to try and give a chance for healing of the knee. Many patients have this symptom of instability, and if the MRI shows associated injuries inside the knee, then they will have to be taken up for surgery. Now, surgery for ACL injury used to be in the previous days an open surgery. That means the whole knee joint had to be opened and then the ACL had to be reconstructed. However, in the current days, the beauty of the treatment of ACL surgery is that it is done through an arthroscopic technique. That means small portals are made at the knee joint, and then we send in an arthroscope or a sort of a camera and then repair the injured ACL. This arthroscopic ACL reconstruction is done principally by just taking another graft from the body and putting it in the place of the ACL which is injured or torn. There are several options for taking this graft, but the most common graft used is the patient's own hamstring from the same limb and then putting it there, or we may also take the patellar tendon. So, this is in brief about the treatment of ACL injuries. It is very important to consult your orthopedic surgeon and take prompt treatment, because if not treated, ACL injured knees go in for early wear and tear of the joints, which is disabling for the patient in the future. Thank you.
Sunshine, it's sunshine.